Hi everyone, I'm back with the new nurse using decimals in the clinical setting. And if you're that new nurse who's not very familiar with clinicals using decimals, we have some helpful hints for you. Also, if you go to dearnurses.net and look at math solutions for nurses, this was specially designed to help the new nurse who's not familiar with how to use decimals, not just decimals, fractions, and many other helpful pointers. Now let's get started on the new nurse. Some of the ways you can help to decide where to put a decimal point. Well, what exactly is a decimal point? And to put it simply, the decimal point is based on tens. So what we're going to look for is how do we line it up? One of the helpful things is having a calculator. This is extremely helpful. If you have a calculator, I guess it does most of the thinking for you. But then, what happens if you don't have one? Here is a simple way to define how to know if the point is in the correct place. You adding or subtracting, it matters not. What you do is, let's take the example here, 2.15 plus 11.15. Make sure the point is over the point. That way whatever numbers become before or after will be in the correct place. Here we have again 7.35 and 2.25. Regardless of where you put the other numbers, the point is in the correct place. Once it's lined up correctly, you can most certainly know that whatever numbers are right or left are in the correct place. Now here is a nurse who has got a doctor's order. She's been ordered to give 1.5 cc of medication. But guess what? She draws up 15 cc's. That is totally wrong, and that is like 4 or 5 times the normal dose. If you take the time to look at the different syringes, you will see clearly what's written 1. And then 0.5 is only a part of another cc. It's not a complete cc. 0.5 is usually half a cc, and 0.25 is usually 1/4 of a cc. So take the time to study your syringes and make sure you have the correct syringe, the correct amount. If you're uncertain, do not be afraid to ask someone who is more secure in doing medications than you are. It is not worth making a mistake. My suggestion to you, it's always okay to ask for help. Even if you're scared, even if you don't want to look bad, it's safe. Always play it safe. Ask someone else who's more certain than you are. And now to round up just a little bit of a tease, we've got here a trauma within a trauma. Does it ever happen? Oh yes, it does. Here is the case of a nurse, Melissa, who has just been called to a code. It's her turn to go to codes in the emergency room. Melissa rushes off to that code. Problem was, there was a sign where the wet floor had just been cleaned, warning to be cautious. Caution, wet floor. Did she notice it? No. Guess what? Melissa slips and breaks her wrist. She winds up with a wrist fracture. Do you think she ever got to that code? Certainly not. If you'd like to learn more about wrist fractures, visit dearnurses.net, the clinical settings step by step. Have a great day.